I'm Jayachandra, Senior Interventional Pulmonologist working in Care Hospitals, Banjara Hills. Now, I've been asked about the treatment and management of lung cancer. I will just give you a brief overview as to how we go about it, because this doesn't come under the purview of a pulmonologist. It is the oncologist who takes over once we diagnose. My job is to diagnose, stage the disease, and hand over the patient to the oncologist, people who are specialized in the treatment and management of lung cancer. That doesn't mean that we don't know what we are doing, because we always do have a understanding. We always tend to be involved with the patient till he is treated and will require our support services during the course of the treatment, especially in the management of fluid in the chest or any narrowing in the air passage giving rise to any breathing difficulty. We are there. We are there to help them out, trying to put a stent or trying to reduce the tumor load and other things. These are so many things that we collaborate and go on with the treatment. Now, these days, like in the past, it is not that you have a rubber stamp of lung cancer and the treatment is as dictated. Stage 1, 1, 2, 3, 4, 5, stage 2, 3, 4, 5. It doesn't go like that. Now everything depends on the analysis of the cancer itself. There's so much of further analysis of the cancer itself that you start your genetic gene mutation studies and other things. And almost all these things will lead to not the earlier concept of giving a chemotherapy and other things. No, probably you have targeted treatment, that you have only a single tablet that you can take at home on a regular basis and keep and following up with the oncologist over monthly intervals or whatever it may be. So this is very, very important. Now, if you're able to pick up the disease in stage 1 and stage 2, probably the best option for these patients would be to go in for surgery. Remove that part of the involved lung, especially if it is in the periphery, remove that, and in most cases probably you have cured the disease itself. So the options would be for treatment of lung cancer, in early stage lung cancer, would be surgery, maybe surgery plus chemotherapy. These are the things that you would think of, or probably in some cases you would think of radiation. In some cases you are given chemotherapy to downstage the disease and then go in for surgery. These are all different options which are usually decided by what is called as a tumor board. That is, a pulmonologist, a radiation oncologist, a medical oncologist, and a surgeon. Everybody would sit down together, put their heads together, go through, analyze the entire case and see what options are there for the treatment of that particular individual, so that you target the right kind of treatment for that patient. It could mean surgery, it could mean radiation, it could mean chemotherapy or targeted therapy, any one of those things. But this is how we go about it. That is what we call as multimodality, or you have a tumor board which works on all these things and then you go on. Where do pulmonologists come in? Earlier we didn't have a role except to hand them on a platter to the oncologist and say goodbye and wish you all the best. Now we don't do that. We are there. If there is a tumor in the air passage, we go in, we remove the tumor, we help out the oncologist in supporting him when it comes to that. Because somebody comes with a tumor in the air passage, he is not able to breathe, but he is still in an early stage lung cancer. That man is not fit enough to go through with any treatment. So what do? We go in, remove the tumor, make him fit enough to undergo the treatment later on. And he undergoes, he does very well. So it's a multimodality, this thing, multi-speciality cooperation in the treatment of a single disease, because the manifestations are varied. So the treatment is also varied. It means the help of oncologists, pulmonologists, radiation oncologists, medical oncologist, surgeon, and so on and so forth. Thank you.